Firstly, this individual is a woman in her 50s, but around 5 years ago, she suffered a brain hemorrhage.
When I woke up, I couldn't move. I've had quite a few moments where I think things have changed a lot. Back in the day, I didn't go around like this.
To begin with, this individual is a female in her 50s, and approximately 5 years ago, she experienced a subarachnoid hemorrhage in her brain. She had 2 surgeries during that period, and the location of the lesion was here. Regarding the paralysis that followed. So, I had paralysis in my left hand and left foot, but through rehabilitation, I've been able to walk without a cane or any assistive devices. However, my walking is still a bit unstable. And also, it is not like it is a major problem, but there were instances when I felt a little stuck when attempting to communicate. So, about the hand, bending and stretching the elbow is a little difficult, and also raising or lowering the armpit is a bit difficult. Due to the weak pinky finger, I can't make a strong grip when grabbing things. It feels like I can't do a firm grip on that hand. So, essentially, the paralysis and muscle weakness on the left side are a result of damage to the cerebral hemisphere on the side, which is in close proximity to the area where there is bleeding on the right side. The bleeding led to the death of brain tissue when it was compressed, resulting in paralysis on the left side. Consequently, the nerves in the brain have become weakened and compromised. When that becomes a tingling sensation, or when the nerves that control movement are affected, so, like when your muscles stop moving next time, or when there's a brain impairment on the right side that shows up on the left side, or the opposite. And also, there's this thing with the brain's language center related to speech. If you damage that area, or even if you damage it slightly further away, if the nerves that control the nerves in between are pressed, it can make it challenging to form words or speak fluently, resulting in difficulties expressing oneself verbally. Essentially, rehabilitation is the primary focus. Whether it involves exercise therapy or language therapy, it is typically the occupational therapist who assists with precise hand movements and facilitates the patient's return to their everyday activities. So, this individual had been undergoing rehabilitation, but they were unable to observe any additional progress, so they became aware of regenerative medicine and discovered our clinic. So, after discussing with you about different things, I thought I would give regenerative medicine a try this time, and if it improves slightly, I will go for it. There's this thing called regenerative medicine involving stem cells and PRP. But in this case, we opted for stem cell therapy. At our clinic, we extract a small amount of belly fat and culture the liver cells in it for approximately 6 weeks, expanding them to around 100 million cells. Following this 6-week period, we administer the cells intravenously for treatment. These cells possess the capability to secrete numerous substances that facilitate the repair of the body's nerves and blood vessels, which are derived from the nutrients generated by the liver cells. As a result, it is said to have a high healing ability and can cure paralysis. This individual had a solitary encounter of Kansai Ben dialect on one occasion. After receiving one drip, the effects started to appear after about 3 weeks. The effect is that originally, I could walk without a cane with my left leg, but it was a bit unstable. However, the strength of that leg has significantly improved and it has become more stable. Another thing is my left elbow. Bending and stretching were challenging, as was tightening the armpits. Muscle strength recovery was evident, like the ability to open a bottle cap by squeezing a PET bottle under the armpit, which was highly valued. By the way, speaking of the story, there used to be a bit of a blockage before, but now that they've received liver cells, they say that the conversation flows smoothly. Since the effects of the initial experience have manifested, the individual desires to reattempt it, thus contemplating recommencing the infusion from the onset of demise once more. Liver cell therapy is typically stated to have no significant side effects and is generally considered to be very safe. Demerit is currently not applicable as a form of insurance treatment, so it becomes slightly more expensive and necessary in this context. So, When stem cells enter the body, they produce SO from the damaged areas, right? So there's this homing effect where stem cells move and it's like this function that's all set up and ready to go. I will go to the damaged stem cells and send multiple signals to repair the tissue, as I mentioned earlier. Moreover, the cells themselves play a significant role in regenerating various structures such as nerves and blood vessels, among other things, as I have previously stated. According to reports, standing up can aid in the recovery of the brain or internal organs to some degree. Nonetheless, it is challenging to administer injections directly to these areas due to their small size. First, we'll attach and foredrip. When inserted in the vein, it circulates to all the toes. Is that the treatment? And it's your knees and joints, you know. For the hip joint or shoulder, we inject directly into the joint because the drip does not enter. That's what we do with local injections. When it comes to the spinal cord, there are some cases where we use intravenous drips, but we still prefer to directly inject into the back, the lower back, and the specific nerves of the spinal cord. This is the method we use at our clinic.
About 5 years ago, the sky turned bright red. My head's fuzzy. I began to feel unwell and eventually ended up sitting down and squatting. So I was taken into surgery, and when I woke up, the surgery was already completed. The first time went smoothly. I was completely normal and full of energy. After being discharged once, I had to undergo another surgery for a hernia, so I went to the intensive care unit. When I woke up there, I couldn't move and my half of the body became unnatural. It was a rather shocking experience, to be honest. I was quite taken aback by the whole situation. Yelling and thrashing like a wild child, all on bed, just like so. And he arrived and restrained me. It was similar to that. So I was genuinely astonished, and the teacher arrived to assist me, but when I was having difficulties, he stated it would be all right and I would improve. But I was released and underwent rehabilitation, but I did not improve. So I pondered if there was any effective technique on the internet, and I discovered regenerative medicine. Allow me to place a call in this location. I had an individual deliver it on my behalf. I've had quite a few moments where I thought things have changed a lot, you know. I've never seen anything like this before, and I couldn't do something like this. Once you get better, you will want to do it again and again, right? It is okay, even if it costs money. You're improving, aren't you? I'm all about that physique, you know.